doctors would just like mush my belly around and be like, well, if you're not saying ow when I poke you, it must not be real. And it's just like, what in the fuck? Like, it was so frustrating. And so I've been trying to understand what ovarian torsion is. Even though I have doctors telling me I have this condition that could cause these symptoms, they will not admit that those symptoms are real for me. And I don't know if it would just mean that they would have to admit that I went in for help several times and no one was willing to help me. Like, what a torsion is, like, and what helped me understand is recently when I got a sonogram, I got a transvaginal sonogram and then like on the belly sonogram. My other sonograms, I've had a few in the last couple months with ultrasound techs that are very rude to me, and do not answer my questions and actually will say something rude instead of answering the question. For example, I heard a noise on the sonogram, like a flowing noise. It sounded like a heartbeat. It was my heartbeat. It was my heart flowing through my ovary. Is what they check to see if ovarian torsion has happened, because ovarian torsion, when it happens so severely, can cut off the blood flow to your ovaries and your fallopian tubes and all that. Like, it kinks the hose essentially. I asked her what that noise was, and her response was, the ER is not a fun place to be. So I asked, what was that noise I hear on the sonogram? The ER is not a fun place to be. I know, I'm sitting here, I'm not having fun, but can you tell me what that noise was? It's just the flow of your heart going through your ovaries. And so after like kind of giving me those like rude responses, I got a CAT scan and a sonogram in November, and while they didn't tell me at that visit that there was anything wrong, later I found out through my gastrologist that there was something wrong when they did those CAT scans. They said that I had some kind of like mass or cyst there. Do you see any cysts down there? And she said, no, I don't see any cysts or anything that resembles what you just said. I was like, oh, okay, so no cysts. And then she sends me back to the doctor, and the doctor gives me a piece of paper that says ovarian. Real quick, other odd things that this ultrasound tech, the rude one before I met the cool one who got to explain ovarian torsion, and then I was like, oh yeah, that's definitely what happened to me after you're telling me these things. But the first ultrasound tech lady was, the first couple were just bad experience. But anyways, other things she said, this is highly unusual. Why haven't you seen a doctor sooner? Won't tell me what is highly unusual. I literally just told you I've seen lots of doctors. Nobody will tell me. They actually lie to me. They've done the scans. See what it is. Don't tell me. Tell her this. And then she's just like, you should have gone to higher ups. What do you mean higher ups? Like, I can't even get an appointment with a specialist about going to a PCP. If I tell a PCP and they don't believe what I'm saying, they can't refer me to a specialist who can then do the thing it would take to look. And I'm like, I've asked. Like, I was shaking because she just acted like I ignored all the signals in my body, and this has just gone on too long. She said, like, but at the same time told me she didn't see a cyst or any mass. I don't know what you're talking about there, but this is highly unusual, yada, yada, yada. And then I'm like, I'm so confused. And then telling me like I should have tried harder to go to a doctor for this problem that apparently is not what I suggested it was, which is what other doctors suggested it is. And she's telling me it's something different, but can't tell me what it is. And then I go see the doctor right after the scan, and he's like, it's an ovarian cyst. And I'm like, does anyone know what the fuck they're talking about? Because I'm getting different answers everywhere. The best I can do is look and know every detail about each one of these things, which is what I've done for the last year. Like, I have just like hyper focused on fixing my health. And some of the things I would need, I don't have access to. I can't give myself a surgery. I can't convince a doctor to give me the blood work it would take. I can't convince them to give the scan. They have to look at me and believe what I'm saying and then do it. And they're like, oh, you're psychotic. It's like, you know why I'm psychotic? Because I've been medically gaslit. I have been denied my experience. I said, this is happening to me. Like, no, there's no way that's happening to you. Excuse me? It did. And now you're like, it has, but we're not gonna like admit that. The feeling of just like wanting to like upchuck a doctor right in the chin it's like right at the tip of my finger every time I walk in somewhere. I'm just like on edge, like, don't fucking tell me. I already fucking know. There's my name. There's the date, June 20th. I get an official answer, ovarian cyst. And then he tells me more about it. And he's like, it's one of these, a dermoid cyst
This type of cyst is sometimes found in both ovaries. Mine's in the right. These cysts may contain different kinds of body tissue, such as skin, teeth, hair, cartilage. This usually do not cause symptoms unless they get very big. Here's the other thing. He tells me this, can't tell me how big it is, doesn't really tell me, he doesn't tell me the definition. When I get in the car and I'm driving home, I'm reading this, and I'm like, what was it that you said? What was it called? Thank God my partner was there, and he was like, it was the one that started with a D, and then he was like, it was dermoid, and then boom. And then I'm like, you couldn't even explain that to me? Like, you can't even, like, say that much? Like, I just gotta, like, read about this later, and then the next time I go to a doctor, they're telling me don't look it up. Like, they're cautioning me not to look up more about it. Like,
cyst. And so I'm like, the sauna lady literally said there was nothing there, and now a doctor's saying there was something there, so maybe she's misinterpreting what she's seeing, and then the doctor had to correct her. Or has that happened multiple times? Like, is that why they didn't say anything the first time? Because they couldn't figure out what it was, so they thought, just don't tell me? Like, but I went in for pain, and you're seeing something that's causing pain. Even if you don't know what it is exactly, you could at least be like, yeah, this is definitely causing pain. Let's look more into it.
This is red flag number one for me with doctors. Like, I am all about informed consent, and it is a huge issue in the maternal area of obstetrics to not be giving women the full information they should know in order to make, like, an informed decision. Which that was all the way back in November 16th, 2023, St. Luke's Hospital. Abdominal pain, unknown cause. Remember, because not the first time I went in for the abdominal pain, but the first time I didn't mention anything about it being me suspecting it's reproductive related. And I did not mention any mental health diagnosis that I had. And that's when I was given scans for the first time, even though I had been in multiple ERs in Kansas, and I had doctors just suggesting that these issues are there because I'm not on psych meds that I stopped taking 3 years ago. So at this point, we're going on 3 years. Diagnosis, lower abdominal pain, negative pregnancy test. I kept thinking I might be getting the hook effect, and that can happen with twins, with loss, with ectopic issues, all kinds of things. A false negative, and so I kept asking doctors, could that be an issue? And this was the first time I didn't mention, can you check for a hook effect? I've had several doctors tell me that's impossible, like their tests are always right, and I'm like, okay, but my hormones could cause your test to not be right, because they're not they're made to read this high of a level, and if your levels are higher, then it's going to give a false negative. There they did the CT abdominal pelvis with contrast and a ultrasound, a transvaginal ultrasound. Stayed in a motel the night before thinking I was going to birth a baby in the shower, and then I couldn't, it just wasn't happening, and I was dilated, and I was like, there's something trying to get out of me, and I don't know what the heck it could be, if it's not a pregnancy, but I know it's there, something. Ultrasound did not reveal a pregnancy, nor did it reveal the cause of your pain. Your abdominal CT did not reveal the cause of your pain. Your labs were normal, they told me. So I slept in the park that night because I was homeless, and I knew that if I expressed that, they would just send me to a social worker instead of treating my actual pain complaint. And they even noticed that my address pretty much gave away that I was homeless, so that because it was a shelter, and they were like, oh, well, if you need a social worker, just say that. I'm like, no, I need someone to address the pain I've been in and the fact that I just lost my placement in the last shelter because I'm here. So and it would have been awesome to be able to get them to acknowledge the pain, treat it, and then send me into a shelter, but I had to sleep in the park and then call a crisis intervention team and have police pick me up and take me to a shelter the next morning. It was done, and I believe I was experiencing ovarian torsion. I then see a doctor in February 13th. I am still living in shelter, and I ask for a note to take to the shelter to explain I have IBS and my symptoms are really bad and I need food accommodations because the food I was eating there was making it worse and I was really sick. And December, January, February, 3 months later, they asked me, did that St. Luke's visit, did they tell you what they saw? I said, they said they saw nothing. Like you have a mass or cysts or something, so I'll refer you to a specialist to look at that. Doesn't admit that that could be causing all the GI symptoms as well. And then I wait 5 months to see them, which that appointment was July 3rd. Went to the ER a month before that and found out more about it before my appointment. I've been puking so often that I've had to go to the ER multiple times.
I'm gonna do one of those, I'm gonna do a green screen video where I read about, I took screenshots of what I learned about ovarian torsion, etc., and all these things, and then I'll read them out loud to talk more about it. Just speaking from personal experience. So after having a lot of negative actions with ultrasound techs, I got one that was super cool. She was